A very good morning. Bonjour. I regret that I can't give this talk in French. Beautiful language, but I'm very happy to be here and thank you for the invitation. Can't think of any better place to discuss healthy eating than in the capital of gastronomy in the world. A few words about myself. I'm a family doctor practicing 30 years in the city of Oslo, and I'm also associate professor at the University of Oslo. I represent the World Organization of Family Medicine, and I will give you a little bit of information about our organization before I go into the core of the topic. 2 weeks ago, I'm in a transitional roles. I was elected the president-elect of Wonka World, of the global organization, and I'm now the immediate past president of the European department of our organization. So, what's Wonka? Wonka is the World Organization of Family Medicine. It's a global organization. We have 151 member organizations from 130 countries and represent more than 500,000 family doctors globally. As you can see from this slide, the European region is the biggest one. And we are in Europe. I'll get back to that, but let's just stick to what our mission is: improving the quality of life of the populations of the world. And that complies very much to the topic here. Wonka Europe represents more than 120,000 family doctors. We have member organizations in 47 of the 53 countries. We divide our regions according to the WHO definition. And the work carried out, we have the annual conferences. We have an open access journal. I mean, I'm tempted to respond to the previous speaker on several points here. So there is a lot of primary care research, available also to shed light on what we're discussing here. We are building our future with scholarships and bursaries, and last but not least, we advocate for family medicine. And that is also what I'm doing here, trying to answer some of the questions already asked. What is the role of the primary care physician, or the primary care health professional, and the family doctor specifically? The work, the content we are delivering is created and developed in 6 networks. And I think all of them are relevant, again, for the topic, health promotion. And if we go from the left, we have the network for education, and it has, again, already been addressed. And I think the WHO, which we have a very good relationship with, Wonka, we can deliver some answers to the questions, how to do it. We have a lot of evidence on what works in education, not only in training of the professionals, but also in the encounter with the patients. Next network on patient safety and quality, EGPRN, is the research network. EuroPrev is these days having their annual meeting in Porto. Again, where health promotion and prevention is their main topic. We have the network for rural medicine. And last but not least, the network, the Vasco da Gama for young doctors. And Vasco da Gama is even represented here. Can you raise your hands, please? They are over there. And you see the blonde one? She is even the president-elect of this network, Katarzyna Nestor from Poland. Are there any other young doctors here? Doctors who are in training for family medicine? No hands. Oh, a few. If you don't know Vasco da Gama, why don't you make a move in the next break? Okay, so that was so much about Wonka and the organization. Going then to our headline. I said our mission is to improve the quality of the lives of people of the world. And that complies quite well to the Sustainable Development Goals, especially the goal number 3, health and well-being. My statement here is that if we shall succeed, we need to create a paradigm shift from the disease model to the health model. But we are trained, and our main task is to diagnose and treat. So we are used to label people with diagnosis. If we shall succeed in health promotion, we must also manage to work on other premises than the diagnosis and the disease model. I'll now go to practice. This is my practice, my professional home, center of Oslo. This is part of my team. I will focus on the role of the doctor, but I need to say that everything we do in primary care is teamwork, and especially health promotion. So let that be clear. And now I'll speak more about the doctor's role, and I'll show you this movie first to set the tone.
I remember the first time I met you. You were so good. Even though you cried a lot. I remember your first football game. And how many goals you scored. You have shared with me what you didn't want to share with anyone else. And what you couldn't wait to share with everyone. We've had some tough times together. We have felt powerless. And powerful. Life is full of joys and sorrows, but you are never alone.
Thank you. As you understand, this is a promotion video for family medicine. Can I asked about young doctors, how many of you present here see patients, client, whatever, on a regular basis? How many of you meet the people, the individuals? Hands up.
Are the young people?
No, all of you. I mean, and in whatever role. Good, yeah. So, you with the hands up, we have a lot to teach to the rest of this audience. What happens in the consultation room? Okay, let's move to family medicine again. What is it? General practitioner has already been mentioned. I use family doctor as the term, as we have decided on Wonka, because there's a lot of confusion about the titles. In some countries, general practitioner has no specialty at all. So that is why we stick to the family medicine term. It is a specialty in its own right. I myself, I have 5 years of training after my graduation from medical school to be a family medicine specialist. And if you look at this tree, and you can go back and look at this tree, this encapsulates the definition, and the definition is much longer. What it also implies is that family medicine is actually based on an ideology. We provide comprehensive, personal, continuous care. And we believe, and we don't only believe, but we know, that if we provide people with high-quality family medicine, that can be a measure to decrease the inequalities in our populations. Okay. Our mandate is much more than intervention on risk factors. That is also a headline here. You can go back to the definition, but you will see under the comprehensive approach that we also emphasize health promotion. In a well-functioning health system based on primary care, more than 90% of what is presented in the family doctor's surgery can be handled there. That means that the huge volume of people going through the family doctor's surgery is a key and a fantastic, I'm gesticulating here, perfect opportunity for intervention. But what do we mean with intervention? This is where we find the golden moments. And it has to be a shared agenda. If it's only the doctor's agenda, I can tell you, you don't need any evidence at all. You will not reach your goal if it's only the doctor's agenda. So, finding the golden moments in this population, that is first thing. This is again another illustration in addition to the short video I showed you. I mean, what we're really doing, these are pictures from the last couple of months from my practice. We are actually providing the from cradle to grave service. And of course, you can see, I hope, from these photos, where the golden moments might be. The small baby and the mother. The family, I knew the mother before she got these two children, and she was newly arrived from Afghanistan as a refugee. The young man I'm taking a blood sample from, I've known him from before he was born. And the old lady I've known for the last 25 years of her life. These 3 or 4 situations, of course, requires different interventions. We should set different goals, and it's, again, much more than focusing on risk factors, individual risk factors. The risk factors must be implemented in the context. Some of you will know the Danish philosopher. He wrote about the art of helping. And you can read here, if one is truly to succeed in leading another person to a specific place, one must first and foremost take care to find him where he is and begin there. This is the core of what we call person-centered care, which again is the core instrument, so to say, we use in family medicine. And what does it mean in practice? This is linked actually to what I said about changing the attention from the disease model to the health model. It is linked to Kierkegaard's statement, because we have to include the patient and the family in setting the goals and how to reach the goals. And that takes some patience, and it takes a lot of respect. You can imagine yourself, I mean, only here I'm used to having my own profession being, talked about, not talked about other than the WHO representative did. What do we do with GPs or family doctors? I mean, for us as patients, when we feel that nothing wrong with what was said, but it just gives a small indication. If the agenda is only ours, we'll get nowhere. So, inclusion of the patient and their relatives in making a joint design and mutual agreements. Maybe the BMI, the goal for the BMI is another than what is written in the guidelines, and that is what we can achieve. So what we do in all consultations in family medicine, whatever it is, a worry, a symptom, a sign, to interpret what's on the patient's mind and the patient's heart, what the patient needs help with, what matters for the patient. We have to understand the individual context. And now I'm speaking individual context. Of course, that also reflects the society the patient lives in, but the individual context. So far, we have only briefly touched on the socioeconomic status of the patient, which is extremely important when we are setting these goals. And that is, again, linked to education. What are the ideas and beliefs? I mean, religion gives some guidance to many people as to how and when they shall eat and what. Emotions, food and emotions, say no more. And also the expectations to what you, as the healthcare provider, actually can help you with. To understand that, to start with, is key to get any way at all. I would say in all the activities we are carrying out in family medicine. So food is so much than nutrition. I'm not sure if you can see, I will explain the photos. One of the photos could have been a Norwegian barbecue. You know, when Norwegians have sun and summer, we love to be outside. We can't get enough of sun, and we can't get enough of barbecues. And I can tell you the shops are flooded with, no, not fruits and vegetables promoted to take to the barbecue. And this is building identity for the family, for friends. I mean, come over, we'll have a barbecue. That has to be understood. I mean, finger pointing people and saying, no, you shouldn't. I mean, you don't get anyway. You have to understand that context. You have to understand the Arabic meal. Who is making the food? What are the roles of the gender? I mean, in gender roles in the family. What is linked to the gender roles? What is here making and creating identity? What is giving recognition? And what is creating meaning? The last picture is my son. He came home from his studies abroad, and we were making a ratatouille, which is one of the favorites in my home. And we made this together, and he's looking at it, and he's looking so much forward. I mean, this is coming home. Well, I shall not say that I only eat healthy, and that was not the point by showing it. But this is one of the way of creating meaning through food. So, back to the context. We need to find the different solutions. And I can't now pronounce the last name of the WHO speaker, but to answer some of the questions here. I mean, how to do it, how can we train, how can we make guidelines come true? Okay, ask us. This is, as he said, not only about trials. This is about feeding back experience from the practical context. And that is very interesting. I've been advocating and also collaborating with WHO Europe for many years, and I think it's a fruitful collaboration. But what we lack is to decrease the gap between the public health thinking and the experiences actually made in the everyday life of the everyday practitioner and health professional. So I don't need to spell it out that these contexts need different solutions and approaches from my side. So my basic question is, when we speak health promotion and healthy eating, fruits and vegetables, how can we make this meaningful for the individual, for the family in their context? And that takes time. Summing up, and this also maybe complies or can answer some of the questions asked here. If I and this is actually what I say when I teach medical students and also trainees in family medicine. Knowledge, we speak about knowledge as if that is what we teach in the medical faculties only. That is, knowledge about medicine and here nutrition is a requirement, but it's not sufficient. We also have to have knowledge about the knowledge. And as academics, which we all are, we should be able to ask the question, okay, how far is this true? And how can it be implemented? Is it true for this population, this individual? And guidelines, dear colleagues, are guidelines. If we only stick to guidelines, we will not reach our goals. We have to think and reflect and implement the guidelines. If I have one take-home message, that would be the one. We have to have knowledge about the culture. And last but not least, we have to have knowledge about ourselves. How do we work towards or function towards another person? What are our default positions? Where do we make mistakes? Where do we overrun and take over the life of the patient? When do we invade another person? That's not our mandate. Never. So the skills needed is to recognize the golden moments. And it is a respectful approach. I like the quote at the bottom of this slide. We shall always, and we know it, if we think of ourselves, I'm sure, and I made this exercise also in WHO meetings sometimes, so people are speaking policies and they're speaking health and health promotions. Okay, do you have any habit at all which you know is not healthy? Yeah. They wouldn't lie. And then I ask, why don't you change it? And then we laugh, of course, because we know there are so many good reasons for not changing your habits. It doesn't mean many of us, and I think at least in my country, and I know this is different in different countries, and the socioeconomic gradient explains the differences. Many people have a lot of knowledge. Many people have a lot of knowledge. That is not what they lack. So the quote is meaningful to me, saying man needs more to be reminded than instructed. And then, when reminded, may be helped to the next step. Thank you for your attention.